Remind everyone remind everyone that we've muted your lines, and should you wish to speak or ask a question at the end of the presentation, please enter them as we go along in the chat box, and I'll happily call on you when we've reached the Q&A portion of our session. Welcome, everyone. I'd like to begin by acknowledging the Indigenous peoples of all the lands we're on this afternoon, those of the Matagami and Matachewan First Nations in the Treaty 9 territory. Welcome to Building Inclusive Communities with the new Safe Consumption Site. This is a panel discussion, and my name is Rob Knox. I'm the president of the Chamber and your moderator for today's session. Mental health and addictions are an important discussion to the Chamber and to our members, which have no bias in its effect. Special thanks to our event partner, the Timmins and District Hospital, for their support in hosting this event, and we look forward to today's discussion. At this time, I would like to invite the Timmins and District Hospital CEO, Kate Fife, to bring a few words of welcome. Kate?
Thank you so much, Rob, and good afternoon, everyone. I'm very pleased to be able to join you this afternoon and share a few words in advance of the presentation. I would like to thank and acknowledge the Chamber for this opportunity. It is so important that we stay connected to our business community, specifically as we're moving forward with initiatives such as this. So really, thank you, for making this possible for us. I also want to extend my thanks to all of our participants today. Thank you for your interest and participation, and look forward to fielding questions and working with you as we move forward with implementation. We wanted to bring a presentation to the group, really to share an update on our new initiative, the Safe Consumption Site, opiate overdose prevention site, or otherwise known as an urgent public health needs site. Really wanted to be able to share a bit about where we're at on the journey and why it's so important for our community to be able to move forward. Overdose prevention sites are controlled spaces where people use previously obtained drugs under the supervision of health professional workers to prevent death. And we know that there is a lot of misinformation and confusion around how a site operates, what the purpose is, and how the benefits, what are the benefits to the community. We wanted to be able to share a bit about how we've prepared ourselves to bring this important initiative to our community, the research that we've completed, the sites that we've talked to, those sites that are already up and in operation, and how we've learned from their lessons. It is so important for us to be able to bring forward the opportunity. We know it will make a difference in our community, and we know it will save lives. We also are thankful for the opportunity to connect with our business community. We know that there's many questions, many concerns, and many perspectives around the overdose prevention site and the strategies that need to be put in place. And we're thankful for the opportunity to have a dialogue directly with you. And for us, it's the start of many, many conversations where we will work together to mitigate risk and put forward solutions that will make a difference. So with that, I will pass it back to you, Rob, and really look forward to hearing from each of our panelists, and as well being able to take time for questions at the end.
Thank you very much, Kate. Well said. Today's panelists feature Meagan Baranyk, the Community Strategies Coordinator for the City of Timmins. Excuse me, Meagan. Lianne Catton, she's our Medical Officer of Health of the Porcupine Health Unit. Tina Brunet, Program Coordinator, Harm Reduction of the Porcupine Health Unit. Patrick Nowak, a Public Health Nurse, also at PHU. As well, Darren Dinel, an Inspector from Timmins Police Service. So at this time, I'd like to turn it over to Meagan. Good to see you again and welcome. And Meagan will lead us in today's panel discussion. Take it away, Meagan.
And in fine Zoom fashion, Meagan, you're on mute.
How about now?
Beautiful.
Perfect. So as Rob said, my name is Meagan and I am the Community Strategies Coordinator with the City of Timmins. So one small part of my role is to coordinate engagements for the Safe Consumption Site that will be opening in Timmins. Another part of my role is to make sure that the results and the outcomes are available to groups such as yourself to ensure transparency basically throughout the whole process. So on the agenda today, we have the opioid crisis. So basically our context, local context around the opioid crisis. And number two, what our community response has been to this crisis and what else needs to be done. Number three, supervised consumption sites. So what are they? What do they do? And how have they worked in other communities across the province? And most importantly, the outcomes. And number four, Safe Health Site Timmins. So our Safe Health Site, our supervised consumption site, what the services will offer, what steps are in place to ensure client, staff, and community success, and what steps will be in place to ensure any concerns are addressed. And we do want to take the time to be able to determine how we can work together moving forward. As discussed earlier, there are 4 agencies here today, and Safe Health Site Timmins is the direct result of a collaboration of planning and implementation of many different agencies that belong to Timmins and Area Drug Strategies Committee, which is TADS for short. So the Public Health Unit, Timmins Police, the hospital, and the city are all members of TADS, and other members include addiction and treatment services, mental health services, primary care providers, and social services. So the City of Timmins has been working closely to support this initiative. So the city provided the funding for this temporary site. Porcupine Health Unit will be speaking as the health unit has an overarching role and experience with harm reduction in Timmins. The hospital is here as the hospital is the operator of Safe Health Site Timmins and will be overseeing the staffing and day-to-day operations. And TPS is here because they have been working closely to support this initiative, and they're looking at it through the community safety lens. So I'll now have Dr. Lianne Catton talk to you about the opioid crisis.
Thank you, Meagan. Can everyone hear me okay?
Loud and clear.
Perfect, thank you. And Tina's going to go ahead, thank you, and manage my slides. Otherwise, we will all be in trouble trying to follow them if I'm managing them. So thank you very much for inviting us here today and for welcoming us to have this really, really critical discussion in terms of really important next steps as a community that we need to take, working together to support those who use substances, to prevent the tragic outcomes that we continue to see at alarming rates, and to move forward with an important component of an overall comprehensive strategy that really is required to address opioids and substance use within our community. And hopefully by the end of all of this discussion, it will give you an idea of the immense amount of work that's gone into really trying to address this crisis in our region, and the amount of work that's gone into the Safe Health Site Timmins, and really the absolute need for it as we go forward. So this is just our health unit vision, mission, and values, which I think most people know, and we'll just keep on going. Tina. So when we look provincially, and I'm sorry, people's pictures are covering my view of this slide, so I'm just going to see if I can maneuver this a wee bit. There we go. So we know during the pandemic, unfortunately, the rates of opioid-related deaths rose significantly in half of the Ontario public health units. And this initial data is from 2020. And so we do expect, unfortunately, at least if we're looking at our trends across the PHU, that likely this has continued in 2021, if not increased. The highest rates of opioid-related death during the pandemic during 2020, occurred in Sudbury, Public Health Sudbury and Districts, Porcupine Health Unit, and Algoma Public Health Unit. And we know that definitely we saw increases across the north overall when we compared to the rest of the province. And we know that the inequities and that the challenges facing our population are unique and do play a significant role in this. For 2020, the Porcupine Health Unit had the second highest opioid-related death rate in the province. And this is absolutely alarming and something we definitely want to and have been and need to continue to address in every manner we possibly can. And I think I'm going to pause for a minute just to say that often we get talking about numbers. I'm going to talk about rates and numbers of deaths and numbers of people lost and where we stand in provincial standards. And I think the most important context that we need to take immediately before we start going through the numbers is to recognize that each individual is someone's family member. We're talking about people's loved ones here. These are someone's children. These are someone's mother, father, aunt, brother, sister, best friend. These are individuals that have been lost from our community, lost from their families, their loved ones, and it's had a significant impact on each and every one of those losses on their loved ones. And I think it's really important that we reflect on that, because it's easy sometimes to get caught up in numbers and look at rates and not recognize and acknowledge the tremendous impacts and loss that it has had. And also important to recognize that prior to this, we saw way too many losses. One loss a year is way too many to an opioid crisis. And I think this conversation and the work that's being done and having all of you here today is such an incredibly important step forward in doing everything we can to prevent other families and loved ones from losing someone that they've been trying to help. We all absolutely play a role in this, and we all as a community collectively share the responsibility in addressing this. So when we look at 2020, 40 people in the Porcupine Health Unit area unfortunately died from an opioid-related overdose, compared with only 22. Again, way too many at 22. It is too many at 1. I can't emphasize this enough. In 2019. That was an 81.8% increase in the rate, which is completely alarming and definitely requires all of our collective attention and dedication. This equates to a rate of 46.9% and 25.8% rate per 100,000 for 2020 and 2019 respectively. The Ontario rates were just over 16 and just over 10. We have a lot of work to do, and we definitely need everyone's support to do this. In Timmins alone, so recognizing the Porcupine Health Unit, as many of you know, covers a very, very broad area. We know that the risks are similar in the entire region. Our concern and our need to respond includes the entire PHU region, but we also recognize that the Safe Health Site Timmins is really looking at a lot of the Timmins numbers, even though we often support individuals from other areas across the region. In 2020, most of these deaths were in Timmins alone. So 31 or 86% of the deaths that accounted for this extremely high rate in 2020 occurred in Timmins alone. Unfortunately for 2021, we know this is not changing. We really wish that we had different information to provide, but unfortunately, preliminary data from the Chief Coroner's Office shows that the PHU area still has a significant number of substance-related deaths in the first 11 months of 2021. So again, preliminary data, but we have 36 substance-related deaths for the first 11 months. So once we have more finalized and add additional preliminary data, we'll definitely share it, but unfortunately the trend is not improving. The greatest risk does tend to be using alone. Now, 73% of opioid-related deaths during the pandemic occurred when no one was present to intervene. And this was province-wide. This was data that was released last year that most of you reported on, which has been incredibly important. We also know that this was similar to pre-pandemic trends. This is something that we've seen for a long time, and that is how really safe consumption sites and a lot of the measures that you hear groups talking about have come to fruition. It's really recognizing the risks and trends that are inherent that result in individuals overdosing and unfortunately dying. So the issue obviously with using alone is, although we have naloxone, although we talk about overdose prevention, people need someone present to call 911 for emergency services. People need someone present to administer naloxone to save their life. And so knowing that we need people present to support them is a really critical key in how we can move forward to save lives. We also know that other substances play a role in the death rate, and fentanyl does definitely continue to be a major concern. It contributes directly to 87% of opioid-related deaths during the pandemic, and this is up from 75% prior to the pandemic. Again, this is Ontario data. We know that benzodiazepines are often involved, and that has continued and increased pretty significantly during the pandemic to almost half of overdoses, and stimulants such as cocaine and methamphetamines are also often involved. So this was part of the community's mural that went up in 2019, a beautiful representation and tribute, and just a really significant reminder that these are community members, these are people's loved ones that are lost, and that we need to recognize and acknowledge that and do absolutely everything we can to support others in our community from ending up experiencing this type of tragedy. Not only are we recognizing that people are dying, and the direct discussion that we're having today around safe consumption site is linked with saving lives, we also know that the impacts of overdoses that don't result in tragedies have significant impacts on our communities, on community members, on families and loved ones. And that is where we really continue to work from a multi-pronged approach to ensure that we're addressing substance use from every angle possible. And this is where we have the comprehensive drug strategy. Now, the Porcupine Health Unit, the hospital, social services sectors, CMHA, many partners, Timmins Police, NAPS, OPP, many partners have been involved in the Timmins and Area Drug Strategy Steering Committee for some time now. And there's also been a frontline group that's been trying and working to address this for many years, but we know it's very complex and it requires a comprehensive approach. And when we look at a comprehensive drug strategy, you're really looking at 5 pillars here. So you're looking at prevention, really looking at the social determinants of health and equities that end up impacting individuals because of societal inequities that may end up being greater risk for using substances. This is looking at housing, supporting policies, healthy babies, healthy children, young families. Then we look at harm reduction, and where we have naloxone distribution sites, safe supply, harm reduction, health education, really looking at overdose prevention, how to support individuals to stay well and connect them with other services throughout their journey of using substances, as well as what the main topic is today, the safe consumption site. And then we have treatment, as everyone is aware, and we hear that and we know that that's an ongoing need as well as enforcement. And these are really important tenets of the drug strategy. And then obviously the emergency management, which unfortunately we have had to flag all too many times over the last several years, that we've seen urgent increases and tragic increases in opioid-related overdose or suspected opioid-related overdoses that have led to alerts out to the community with, increasing conversation with school boards, with those who use substances, with all the partners at the table, to making sure that we're getting naloxone naloxone into hands, that we're letting people aware of perhaps there's certain trends such as a new substance that may be out there. But unfortunately, it's not enough. We need all of these things working in tandem, and it does include supervised consumption sites. And there's much evidence to demonstrate this. It's important to recognize that it is just one component, but a very, very critical one. We need it to save lives immediately so that we can continue the work in all of these other areas, continue to save lives and prevent the tragedies that families and our community continues to experience, while we continue to work on the broader aspects of preventing individuals from using substances, supporting those who are currently using substances and ensuring they have ongoing treatment, and linking them to the supports that are necessary. So all in all, I just want to thank everyone for coming out today with an open heart and an open mind. We know that there is often much discussion around how a drug strategy is implemented, how we respond to crises such as these. And I think it's incredibly important to recognize that much of the approaches have significant amount of experience and expertise, as well as evidence behind them. And that it is not one single thing alone that is going to get us through this, but it is looking at all of the pillars of a drug strategy, all of the pillars of a community response. And it's really absolutely critical that we have everyone on board, that we work together to support those who use substances, to support families who are supporting those who use substances, that we're doing everything we can to wrap our arms around those in our community who need it, and that we're taking the steps that are necessary to save lives. And we need to do this in a very, very urgent manner. Thank you. Merci. Miigwech.
Perfect. Thank you so much, Dr. Catton. So my name's Tina Brunet. I am a nurse at the Porcupine Health Unit, and my current role is I am the program coordinator of the harm reduction program here at the health unit. And I'm going to cover a few slides just to talk about supervised consumption sites in general. And they have been around in various forms across the country and the world. And there's a lot of information available, and I'm hoping to share some of that information with you over a few slides. It is important to note that during our planning phase, we did conduct an environmental scan. So we did contact many, many different sites in the province of Ontario to see how they're running, to see what their barriers were, to see their successes, and to learn from them. We also had team members actually go and visit some of these sites so that we could see firsthand how these were running. And we included various sites from Southern Ontario so that we could see the best of all worlds and see what we wanted to pick and choose from. We know that there are other larger centers in Northern Ontario who are on the same pathway as us to try and implement one of these life-saving sites in their communities. We know that North Bay and Sudbury are currently in the planning phases. We also know that Thunder Bay has a site currently in operation that's been in operation since 2018 called Path 525. So let's talk in general about supervised consumption sites. So as Kate mentioned, they are safe, controlled environments where people who use their own pre-obtained substances in the presence of trained medical staff. They are a medical intervention that addresses a health issue, addiction and substance use, and the harms associated with them. They do provide an alternative for people who use substances so they're not using alone. And individuals are provided with other services, including new harm reduction supplies to ensure that they're following safer practices and that they receive education on substance use and available treatments. Supervised consumption sites have many, many different names, and it can be really confusing. So I'm going to try and break it down quickly. The name usually coincides with the permanency of the site. It usually coincides with the application or applications that you have to complete for the site. When there's changes in governments, the names of these sites often change as well because new requirements are put in place. So we often use the overarching term supervised consumption site just to talk about all of these sites. Some people call them overdose prevention sites. Some people call them safe injection sites. The one we're talking about today specifically, Safe Health Site Timmins, is actually an urgent public health needs site, and it falls under that application. But in general, we just try to simplify it by using one term. No matter what the name is, though, the overarching principles remain the same in all of these sites. It's a place where someone who uses substances can go to be observed by a medical professional to prevent deaths. To operate a site, you must receive an exemption under the Controlled Drugs and Substances Act from the federal government. This exemption is what allows a site to legally operate in Canada, because the exemption allows for legal protection from simple drug possession. The exemption is very specific and very specific to a certain location. In addition to all of these things that a supervised consumption site is, we know that oftentimes people use substances are marginalized and have huge barriers to accessing health-related services. Sites like this allow individuals who are already marginalized to have connections to other services, including treatment services, housing services, and many more. So let's take a quick look at what the research is telling us. Canadian international evidence show that supervised consumption sites and services help save lives, connect people to services, and serve as pathways to treatment. They save lives because people aren't using alone. And Dr. Catton did a good job of showing us how that is one of the #1 risk factors in dying from an overdose, is using alone. So this eliminates that one risk factor. There's someone there to intervene. Oftentimes people also don't think about, though, it saves lives because people aren't rushing. So there are harm reduction messaging and practices that people can take to reduce the risk of dying. That includes starting slow and going slow. When you are using in a public space and rush, you are unable to follow those life-saving measures. So this site also serves to allow those life-saving measures to take place. And it also allows individuals to practice hygienic practices. And for obvious reasons, someone is there to intervene if things don't go well and to save a life. These sites also have been shown to, because they promote safer drug use practices, they can help lower the risk of infections like hepatitis C and HIV, because they have access to new equipment each and every time. However, one of the things we don't often talk about are some of those other medical issues that can arise, like abscesses and endocarditis, and ensuring that people have a clean, safe place to go to with new equipment every time lowers that risk as well. And we've talked a lot about how these sites aren't just a place for people to use substances. They're a place to connect individuals to services that will help them when they're ready to be helped. We know that when you have a rapport with an individual who uses a substance, they are more likely to start and initiate those conversations about treatment. If you don't have a safe place to have that, build that rapport, we will never ever get to a place of treatment discussions with an individual. There are also practical benefits as well to these sites. If we just think of one, having a place to use a bathroom, huge practical benefit for these individuals. What you will notice is what I'm going to talk about, the impacts on the community, actually reflect a lot of the same impacts on the individual, but just at a broader level. So when we look at what the research shows us about how these sites impact a community, if we look at saving lives, we know that saving a life impacts everybody in the community. One death in a community is tremendous, and saving the lives of our fellow community members doesn't just impact the one person's life who was saved. It's a trickle-down effect, and it impacts many in our community. They also save resources, including money. When you have a site in place, it can reduce the 911 calls. This reduces the strain on emergency services so they can focus on other emergencies. I believe our EMS calls related to overdoses, I believe, increased 100 from 2020 to about 2021. So that's huge if you think of the number of calls that we would save. And in our community, it's not just the ambulance that shows up, like many northern communities. So this actually impacts all first responders, not just ambulances. We know that these sites also lead to less use in public spaces, and this can have a very positive impact on the community. We talked about why this is positive for the individual, but it also in turn has an impact on the community. This offers additional benefits for police, emergency services, and businesses. If people are coming to a site, it eliminates the need for them to be using alleyways, stairwells, or bathrooms. And from a practical perspective, on the flip side, it also becomes a place to refer people to when you may come into contact with someone who might be using in public. Instead of having that vicious cycle of just stop using here, but with no alternative, we now have an alternative to send somebody to stop that cycle. These sites also lead to less improperly discarded needles. These sites have policies and procedures in place to ensure that there are locations where people can discard their sharps so that no one else is impacted by them, not only in their site, but usually they do sweeps as well around their site, but there usually are kiosks as well around the sites as well. What we have to remember is that these sites are strategically placed in locations where public drug use is already occurring. What the research shows is there's no evidence that these sites shift drug use to different neighborhoods, and there's no evidence that these sites increase drug-related crimes. So I've talked a lot in general about what the research is telling us about these sites, but I wanted to bring it closer to home, just to show you how the impacts mentioned on the two previous slides translates into real life numbers. I want to share with you the impact of a site in Kitchener, Ontario, reflecting their first full year of operation. During this time frame, they had about 5,800 visits, averaging about 16 visits a day. The site was open 12 hours a day, which is typical for one of these sites, 7 days a week, including holidays. These sites really try hard and put processes in place to ensure there's no disruption of services. So every day they're usually open. As you can see on the left-hand side here, no overdose related deaths occurred on site. So saving lives, check, it did that. They intervened in 188 overdoses, and only one of those overdoses resulted in a call to 911. So when we talked about how this can save money and our resources, our community resources, this is demonstrating that. 911 was called 11 different times for other medical emergencies. So that might be including mental health crises and things like that. Security interventions were required only 12 times in the whole year of operation, 12 hours a day, 7 days a week. And like many communities, when they first start talking about a strategy like a supervised consumption site, there were concerns. There were concerns that it would have a negative impact on the community. However, the feedback and data has shown concerns related to the site have been minimal, and the site has not required significant policing or security staff attention. Problem solving among partners remains ongoing and proactively addresses concerns should they arise. So in summary, the evidence is clear that these sites save lives. We are in a position that we need to act urgently to save lives in our community, and this is a tool that's available to us. We do care about all members though in our community, and we want all members to have access to life-saving services, all members to feel connected to the community, all members to feel safe. I'm going to hand it over to Pat Nowak from Timmins and District Hospital now. He's going to talk to us about next steps, about how we're aiming to meet these goals with the implementation of Safe Health Site Timmins.
You caught it before I did. Good job.
The dollar in the jar, as always. Can everyone see my screen okay?
Looks good.
Great, thank you. So first of all, again, I'd like to thank the Chamber for hosting Timmins District Hospital, the Porcupine Health Unit, the City of Timmins, and Timmins Police Services today. I'm joined from TDH with Kate Fife, the CEO of the Timmins and District Hospital, Natalie Carl, our Director of Clinical Services, and myself, the Manager of the Addictions Program. So we're going to be talking about Safe Health Site Timmins, and we'll go from there. So just to reiterate of the points that the Porcupine Health Unit made before is that this is an urgent public health needs site. And what they mean by that is that this is an application to Health Canada for a temporary and urgent site so we can start saving lives sooner. These sites are designed to be a controlled space, so again, where people can use their pre-obtained substances under the supervision of trained staff employed by the hospital here. And we'll get into the staffing models soon. This is a temporary exemption, so the temporary exemptions typically last for up to a year, with the opportunity to reapply if the need continues to be demonstrated. And as we've seen before, over the past couple of years, it doesn't show any signs of abetting in that sense. Thirdly, there's no funding or no direct funding from the provincial or federal government. So this, again, like to say thank you for the partners as well, especially the municipality and their support for this project, as well as the overall Timmins and area drug strategy for other contributions made to ensure that this site, first of all, starts off well and continues to function as intended. And then we went through the data demonstrating the need for approval. I don't think that needs to be repeated again, just reinforcing that the Northern Ontario health units have been disproportionately affected by the opioid crisis. So what are the goals of Safe Health Site Timmins? Well, first of all, I don't think it's any surprise to know that we're looking to save lives by reducing the number of deaths and drug overdoses. This isn't just deaths we're talking about. We've seen people who have acquired brain injuries as a result of overdoses. We have people whose lives have changed as a result of something that is essentially completely preventable if there was someone there to watch that person and ensure that they got help and emergency help when they needed it. Secondly, we want to reduce the spread of infectious diseases like HIV and hepatitis C, recognizing the enormous cost savings for the prevention of those chronic illnesses and their subsequently expensive treatments. Thirdly, as Tina alluded to before, this isn't just a place to stop overdoses. This is a place where we can provide or refer to primary care services, addictions treatment, withdrawal management, as well as other social services that improve that person's health outcome. And lastly, but not least importantly, we want to create a safer community by reducing substance use in public spaces. So why TDH? Why is Timmins and District Hospital the operator? Well, I mean, to start, Timmins lacks services in comparison to other areas, especially in terms of our southern counterparts. We don't have AIDS service organizations here. We don't have hepatitis C teams here. We don't have a lot of the agencies that would typically take this project on and move forward with it. Lastly, and just to put it in perspective, the nearest AIDS service organization or hepatitis C team is about 4 hours away in North Bay and Sudbury, respectively. And lastly, we're a good fit. Timmins and District Hospital is a perfect fit for this temporary site for a lot of reasons. First of all, we have these demonstrated linkages to other communities between, healthcare and harm reduction strategies. We have a great policy infrastructure that will transfer to the temporary site. We have experience working with people experiencing mental health diagnoses, exacerbations of the same, as well as substance use with our ever expanding addictions programs here. And then for funding, the City of Timmins is the primary funder for this site, and we can't thank the city enough for their contributions to this site, recognizing that we are among the country's highest rates of opioid-related deaths, as well as coverage from TDH of the over and above expenses, as well as CDSAP for their support in the location, as well as helping with the costs and renovations of the same. Again, it's a group effort and a big one at that. So the location. So there were 6 initial locations that have been narrowed down to 2. However, the Cedar Street North was determined to be the location of the Safe Health Site Timmins. And it was chosen for a variety of reasons. We have a higher area of incidences of public substance use in that area. Health services were already previously set up at that location. Lastly, it's also close to health and social services in that region. It's a very central location if people need to go to the hospital, if people want to go to the downtown core to access their appointments and other services of that nature. And lastly, it's easy to get to safely by foot or by transit. It's a very central and accessible location. So where's the application at? So as we said before by the Porcupine Health Unit, that we have to submit an application to Health Canada. We're currently waiting to hear back. They have come forward with other questions that we have answered. But in order for the application to be approved, there does need to be a site visit or a virtual site visit in this case, in order to subsequently get that approval. So how's it going to be operated? Well, it's open 12 hours a day. That'll be staffed with 2 nurses, a harm reduction worker, and 1 engagement and safety liaison. We'll get into the safety, so the engagement and safety liaison after, but we'll have 2 nurses and a harm reduction worker that can provide referrals to other agencies if necessary, as well as respond to any opioid-related incidences that might happen at that site. So what's going to happen there? Well, first of all, we have the safe use of pre-obtained substances monitored by trained staff. Recognizing that the biggest risk factor for opioid-related death is using alone. So by providing a space where they don't have to, by being observed by people who are non-judgmental, people that will build that rapport, and people that will open the door to other healthcare avenues is extremely valuable, not just in saving their life, but improving their health outcomes overall. Secondly, we want to distribute naloxone and harm reduction supplies in collaboration with the Porcupine Health Unit and other partners that already do so. Providing nasal naloxone can go a long way in preventing not just any issues with that particular person visiting the site, but anyone of their friends or family members that may choose not to use the site, but will still have access to that medication. Referrals to withdrawal management, treatment, detox, or any other service that fits that client's need. We have a withdrawal management program here where people can be initiated on opioid replacement therapy here, as well as the subsequent referral networks to get longer term treatment. And then basic medical care like simple wounds, dressings. We have 2 nurses here. If people come in with something that looks, pardon my language, but a little funky, something that looks a little infected, we can have the trained staff to take a look at that to prevent a much more severe outcome from happening down the road. Maybe we can get antibiotics now rather than through an IV or a PICC line, which we've seen, as well as collaboration with other community agencies for service provisions on site. This community has a lot to offer, and we want to highlight those services at our site. Client flow. Again, clients would be screened upon entry, where there'd be a waiting area there. The clients would then use in the consumption area, almost like a little loop. And then after use in one of those booths, there'd be an observation area after the use where they can be monitored or connected with services after that. If they choose not to use, we can still connect them with services as well. So risk and safety. So there's many steps that have been planned to prevent issues from arising and to ensure that these potential issues are proactively addressed. We want to get this right. We do recognize that there'll be ongoing checks and adjustments, as in, bullet point 5 already, but the site tours that have been happening with TDH and its partners have been very, very helpful in designing or ensuring that there are ways that we can reduce risk to the public at this site. We can start with discarded needles, and we've seen on social media, or we've seen on all sorts of locations where, yes, we are aware that discarded needles are in Timmins. They're in a variety of other cities and towns, and we do have a Sharps kiosk at Safe Health Site Timmins. This will be an opportunity, even when it's not open, for people to dispose of their discarded Sharps or whatever else that might prove hazardous to any passerby. This kiosk is already well known and heavily used. Secondly, we do intend to patrol around the site quite often, picking up anything that might be left behind. While we don't anticipate that happening as much, we do want to ensure that we're taking our due diligence to reduce any risk caused by a needle stick or anything like that, even if it doesn't come from our site. Secondly, we have direct contact with the Timmins Police Service, and Timmins Police Service has been a valuable partner in the planning and collaboration of this site. You know, when we did our when we did the planning, I mean, they were immediately, you know, participatory in the planning and execution of this site. I will turn it over to Inspector Dinel for his piece.
Okay. Thank you, Patrick. Good afternoon, everyone, and I appreciate the opportunity to speak about the Safe Health Site Timmins and the policing perspective to it. So in regards to our role in this, we are playing specifically a support role for TDH, the Porcupine Health Unit, and the Timmins Area Drug Strategy overall. So I can say that we provide a support role, knowing that this is a kind of a health approach, specifically with the health site. That being said, there are instances where things will spill over into a policing environment, and we want to make sure that we have the ability to speak with Timmins and District Hospital to make sure everything's running smoothly, that we get things in place correctly the first time. And I really appreciate the opportunity that we've had with the hospital to make sure that we've had that input with them. Realistically, though, the hospital has a very good reputation for having policy in place within our community, and we have very well established partnerships with the hospital that have been existing for years. So that has gone very well. Just on comments on our direct contact with the Porcupine Health Unit, the drug strategy, and the hospital and that as well. We actually have ongoing discussions on a regular basis. We meet bi-weekly and deal with this specific issue about opioids in our community. We have staff from our frontline staff to our administration who have been engaged in various committees, working groups, initiatives, and projects that are tackling this issue. So we're very keenly aware of what's taking place within our community, from the front line up to administration, and we have been dedicated to putting those resources to make sure that we're addressing it in the best possible way. We're going to continue that work with Patrick. He's going to get into more details about the policy, things that have been put in place to prevent any issues from arising that requires people calling into the police or calling into the Safe Health Site to complain about issues that may spill out into the neighboring area. But those things, we've had the input with the hospital to make sure everything's up and running that we can think of at any point. And we've had the opportunity to attend the site visits with them out of town as well. So we have been fully engaged with it, and we will continue to be fully engaged as the site gets up and operational. So thanks a lot, Pat.
Thank you, Inspector Dinel. I want to just go to the next point, which is the on-site engagement and safety liaisons. And this is a staff member at our site who will be trained to de-escalate situations at the site. When we did our site tours, many sites started with security companies or uniformed guards, but quickly changed to internal positions who had the appropriate training to de-escalate situations. As I said, when I mentioned about Timmins and District Hospital policy, we already have resources and training for crisis prevention and CPI, crisis prevention intervention, MOAB, which is the management of aggressive behavior, and things of that nature. And when we talk to sites who have switched from uniformed or contracted companies, they noticed a drastic reduction in security incidences. And this is what we talked about, really getting it right the first time. We don't want security incidences to happen at all, ideally, but we do want to put the measures in place to at least see what other sites have done, implement or learn from their experiences and implement it at our site. So this is what security would look like at a supervised consumption site. People that are not necessarily uniformed, people that are able to build the rapport with people who come into the site, and people who would be able to de-escalate any potential situation that, again, might require police support in the future. They'd patrol and walk outside several times a day, picking up any discarded needles, dispersing crowds, or reporting any suspicious behavior, as we said, to Timmins Police potentially if there's any witness or if there's any potential things happening that might require police involvement. But over and above that, we will also have surveillance systems present to detect potential issues that can also be proactively addressed. You know, having those engagements to disperse congregations and gatherings near the site. And we, you know, SHST and TDH do enjoy a close partnership with Timmins Police Service, who will be called upon to support if needed. And then talking about policies and procedures, you know, there was a huge part of the application process. We really needed all of that sorted and settled prior to the application being sent, and having these processes in place, especially to mitigate any security issues, you know, clients having to sign a code of conduct, and, you know, taking the opportunity to discuss with clients on safe disposal of any substance use equipment or anything of that nature. Although we anticipate if they do use at the site, you know, they'll just put everything right in the sharps container at the table. So, and then lastly, ongoing checks and adjustments. This isn't set in stone. We, you know, recognize that, you know, we have to be flexible and adaptable, and, you know, we can adjust these policies and procedures based on any experiences that we have the opportunity to learn from as well. And then concerns from the public. You know, Timmins and District Hospital has had a long-standing policy regarding patient-family relations process that'll be followed when complaints are received at the site. There's a no wrong door approach anyways to obtaining complaints. They can essentially call anywhere and it'll find itself for me to work through and address with that particular person or agency or group or whoever. Any agency that also receives a complaint regarding SHST, so if the Porcupine Health Unit was to receive a complaint or Timmins Police was to receive a complaint, we would be notified of that issue and forward it to the manager of Safe Health Site Timmins, which would be me. And then lastly, staff patrols around the site. You know, we'd be doing that to ensure any discarded needles or syringes are picked up and to ensure that any potential safety issues are addressed. So going on to something a bit more lighthearted. So this is the community awareness campaign that we're hoping to launch in the coming weeks in collaboration with the Garden. So this is a distinctive campaign that, you know, I recognize that, you know, there's a lot of people in this call or this presentation recognizing that SHST might be an interesting acronym to pick. We were aware of that as well. And in collaboration with the Garden, you know, we have that campaign that'll provoke curiosity and discussion about what this site is all about. It's the best way I can put it. That being said, there will be a website that'll contain the resources and information that'll combat a lot of the misinformation or disinformation about that particular site and really present a lot of the facts that we have presented here today in a manner that's accessible, informative, and most of all engaging. This campaign was developed by the Garden, whose co-founder and CEO is Shane, who was probably born and raised in the Timmins area actually, and has seen firsthand the devastating effects of this opioid crisis. So we thank him and his team for the support from his Toronto-based ad agency, as well as the media partners of Terrence O'Neill, who've created this pro bono campaign as well. So next steps. So we want to provide ongoing communication. You know, this isn't just a one and done. This isn't just, this is it. This is the information. We want to have that ongoing communication with our partners and as well as other relevant stakeholders in our area. So we want to provide the opportunity for the community to get involved as well. You know, perhaps some sort of Timmins group or community cleanups and participating in those, which the Timmins and Area Drug Strategy has done in the past and have collected literally tons and tons and tons of garbage and trash and things of that nature. And maybe even in the future offering a virtual tour or when this, virtual tour. But that being said, we want to ensure that we're meeting the needs of our community and especially the people who will be visiting this site. So after opening, So we want to have those ongoing checks and adjustments. We want to, recognizing that, things might need to change after it's open. We'll find things that might need to be adjusted, that might need to be worked at. And that's okay. Secondly, we want to have supportive service expansion. As I said before, really highlighting the services that our community has to offer. Maybe having them drop in and offer their services, or having those direct points of contact with other agencies. And then the community collaboration that I spoke of before, virtual tours, participating in community cleanups, and so on and so forth. Again, I'd like to thank everyone for their time, and really enjoy giving out these presentations, and really looking forward to the discussion in the future. So again, thank you so much. I'll stop sharing my screen.
Thank you so much. Sorry, thank you so much to PHU and TPS and the hospital for your very informative presentation. And before Rob starts the questions, I'll hand it over to you, Rob. And again, I just want to reiterate that as a group, we really appreciate you all for being here. Rob?
Thanks, Meg. Perhaps we could start with because this is a chamber event, business-related question. Often businesses are impacted when they intersect with social programs and some of the things that are happening in our downtown core. So often the chamber fields many questions from business owners as it relates to these types of programs. Now, notwithstanding the benefits of this program that we've just talked about, and clearly a real urgent issue in our community, what role do you see the business community and how can we assist in this regard? And what is our role? Maybe I could start with Dr. Catton. Lianne, do you have any thoughts about sort of this marriage of business and health?
Thank you, Rob. And of course, always on the hot seat first these days. I think it's a really, really good question. And I think what I'm, definitely what first comes to mind is having your presence here is incredibly important, and people taking the time to come out and listen to why this is so incredibly important, to what is really behind it, what the data is and what the data really represents in terms of what's been going on and what needs to be done. I think having your collective voice and shared support, and recognizing that can be challenging at times, and there's been many things that have happened that may impact that. But I think we know that the business community, especially in small towns, especially in Timmins, is incredibly important and an integral part of our community infrastructure overall. And we all share, for sure, without question, no matter what we do, no matter where we live in this community, we all share a responsibility in taking steps for community well-being for each and every community member, regardless of where they live and where they work and what they do, or whether they work. And so I think the first step in my mind, and I will definitely pass it over to someone else to help with me with this one, is really the first step is exactly what we're doing here, having the conversation. And I think the next thing is really looking to how we can continue to work together, because it is absolutely critical that we have everyone on board. And so having that shared support and that collective voice, that saving and protecting and making sure that everyone in our community has opportunities to health and well-being is absolutely what's needed. And so we recognize the value of your of the chamber and of your members, and really hoping that we can continue, as Pat said, along that journey together, because it really will take all of us to impact this. It's not just the Safe Health site, as I went through. There are many other opportunities that we will have to continue to intersect to help those in our community. Thank you.
Thank you very much. Perhaps Meagan, you could pick up on that and speak to it from a city perspective.
I pretty much agree with everything that Lianne said. I think that this is the first step that we all need in order to move forward with this.
Elaine's posted a question. How are we getting the message to consumers? Maybe Patrick, you want to address this in terms of what are our steps in getting the message out? Obviously the complaints come in from, the various activities that happen around these locations, and maybe from your research and looking at other similar sites, what are we doing to get some effective messaging around it, and who are we targeting exactly?
I think that there's a lot of things that we have planned doing. I mean, using the, not necessarily the template, but a lot of the resources created in collaboration with the Garden and a lot of their campaigns, is that we want to provide client-centric resources to sort of spread the word on where this site is, what the services are offered, and especially giving those same resources to local businesses and things like that, just in case, as in Elaine's question said, seeing people consistently use or inject at that site, and rather than, and just having that conversation and, hey, there's a place that we can go and do that. So I mean, there's also another parallel process, with the Timmins and area drug strategy. If the option to have a more permanent site is happening as well, we have to have that engagement with people who use substances, and it's also an excellent opportunity to bring their awareness to that site in asking them about a lot more detail about their substance use habits, and what the ideal site would look like for them if it were to become sort of a permanent fixture. So and then when the site does become operational, having our harm reduction clinics spread those words as well, whether it's through cards or pamphlets, attaching the information about SHST to any drug alerts that are issued by the Opioid Emergency Response Task Force, and using every avenue that that we have in order to advertise the site.
Thank you.
Sorry, if I can just add to that,
Sure.
Rob, just in response to the question and stuff like that as well. Police are typically the mechanism of complaint when local businesses have public consumption issues that are taking place. We've already rolled out the in-service training for our officers that have already taken place about the Safe Health site. So we really encourage that. So as we receive calls of complaints, we're really pushing this initiative and trying to divert it from the justice system into the health system. So we're encouraging it from our frontline staff that are receiving those calls. We also have our outreach workers and our mobile crisis workers that go out and actively look for these locations where there could be encampments or high instances of public usage. And again, they're going to engage these individuals to encourage them to use the site once it's up and operational. So those things are already taking place in the policing side of it.
Excellent.
Can I also add, it's Natalie here from Timmins and District Hospital. I think I just want to add that our group is open to meeting with any businesses as well, one-on-one, if there's a need to. Patrick certainly is going to be the point person for concerns if people do have concerns for the temporary site. But certainly we are more than willing to meet with any business owner. And I think back to the question of what can be done for businesses I mean, we're really hoping for the support, and and for yourselves as well to get the word out. If you see somebody using and it's, approaching them and saying, hey, are you aware of this site? Especially at the onset, I think Timmins is a small community. Word will get out fairly quickly, but still, I think looking for that and keeping those lines of communication open is key. For us as the operator, we really want to make sure that any concern, any issue come our way, and we'll do our best to address it.
Thanks, Natalie. Dr. Catton, you want to follow up on that?
Sorry, I think everyone else added all great points. And just one other quick thing, I think continue to increase the conversation. whether it's within your professional life, whoever works with you in your setting, your personal life. When we share these alerts, share them broadly. Don't consider, well, I don't think this individual or this family, there's no way, nobody there uses substances. It doesn't discriminate. We've seen tragedies in all walks of life throughout this, and we know the impacts of mental health concerns are only increasing. So please continue to share that, continue to have those conversations. They're incredibly important, and you don't know that perhaps someone that you shared it with, it may have resulted in saving a life or having them find access to services or supports that they need. Thank you.
Very good. Thank you. Turn to Councillor Joe Campbell. How are you, Joe? You have a question?
Very well, thank you. By the way, thanks very much for the presentations from everyone. As you're quite aware, I've asked for a report come to council at some point in time when everything's tied together. I guess my concern can be really put into one situation. The injection site, I guess what you want to call it, the Safe Health Site Timmins, is in 21 Cedar Street. And we all know the issues that were dealt with by the businesses in downtown and the St. Mary's Manor and Science Timmins, and I'm sure Darren's quite aware of them too. There was no consultation with the citizens with respect to putting the site into 21 Cedar. So there is a lot of concern from the residents in the area, having helped to deal with the Timmins with the living space for all those years, that we're going to fall back into a situation where some of them are going to be affected by it. And I've received, you wouldn't believe the number of emails and calls that I've received personally on this. So my question is, once, and I realize there's referrals here, once the person goes there and injects safely, you reference referrals that are going to be available. Now, what follow-up is there that it may have happened in one of the presentations I was writing and maybe not listening? What are the follow-ups to ensure that we're succeeding along the road to get some of these people out of that lifestyle so that they're not just coming in every 2 or 3 days to safe inject and go on to something else? So that's a question that the residents of the area have. Are they going to be roaming around the area refusing to take any kind of a referral towards a treatment? And that's an issue. So I guess my question, I'll throw it out to anybody who wants to answer it. What are the let's say the key performance indicators that we're not just going to have a site there where people are going to come back day after day after day, inject, and then go on to continue that lifestyle? So I'll throw it out to anybody and somebody can answer. Thank you.
Any takers? Natalie?
I can start. I mean, that's a very, very good question, Joe. I think that the challenge is that it's a personal choice. So we are there to support that person through their journey. If they're not ready to access support, certainly we will continue to offer. But it is a voluntary service. We can't force people to get treatment. But again, I think that the value of this service is that it's a place where we'll be able to have conversations about those support services, what exists in the community, what treatments are available if the person is wanting to stop using. So certainly completely understand the concern from that aspect. And again, we do, our consultations are not done. These meetings continue to happen as we speak with various providers. And we hope to continue to reach as many people as we can, or as many groups as we can, as we continue to plan for this temporary site, but also for the more permanent site. I think there was a question in the chat in terms of stigma as well. I think that I just wanted to take a moment to answer that some of that will be addressed with the Safe Health Site Timmins campaign. There's some very direct questions, comments, things that other health sites or other safe health sites have encountered that we've included in that campaign to make people aware of that it's not encouraging substance use. It's not It's not, you know, just a place for people to shoot up. It's really is there to save lives. And so some of those, I think the stigma around that will be addressed in the media campaign that's to come.
Great,
Thanks,
thank you very much. Thank you.
I think Kate will have a follow-up to that, and then I'm going to go to Corey for his questions. Go ahead, Kate.
Yeah, I'll just be quick and really appreciate the question, Joe, with respect to sort of the consultation process, you know, where we're at with the location, as well as how will we measure the success. And, you know, one of the things that I liked about the team's visits to those sites that were up and in operation, and I think in the slides, and we could share that out. You know, we saw from Waterloo, you know, clear measures of connections to service. So not only is it people accessing the site, but also then being able to be referred on and being connected to you know, other services to provide support. So that certainly will be, you know, what we will closely be monitoring. You know, I think the other thing to mention is this is one tool in our toolkit. We have a number of different supports to be able to put forward in opening withdrawal management beds, having safe beds in our community. All of those are opportunities to connect people to service so that they can address their addiction at the moment that they're willing to take that next step. And so it really is a wraparound of supports. And then just the last comment, we are continuing to engage with a number of providers, including St. Mary's, you know, the local businesses, you know, some have reached out to us. We do want to sit down and understand the concerns, you know, think about what the risks are and put together solutions or strategies to mitigate. You know, that will be part of our process with the urgent public health needs site, but also as we look at the longer term site, we'll be looking at what, you know, what location is best suited for the longer term site as well. And there is a consultation process there. But thank you so much for the questions.
Thank you, Kate.
If I may, Chair, if I just might have a follow comment here. My comment here is that the residents area are going to want to see progress in that area fairly quickly based on their experience with the previous tenant. So I just hope that this all comes together and we can stand up and say, we are making progress toward this terrible thing. And it is a terrible thing. No one wants to see anybody dying in the streets or anything, but the residents also have some rights and they're going to want to see some kind of progress. So anyways, it looks like we're moving in that direction and we'll see what happens. Thank you.
Thank you, Joe. I'll go to Councillor Rob and Corey.
Thank you, Mr. Chair. Appreciate it. I want to, you know, my sincere gratitude to the experts here giving me some information, because when it comes to opioid crisis or even being a doctor, I'm just a guy who works in an office. So I appreciate everybody coming in and explaining all this to me. I also see this as a response to the crisis that's here. And the opioid crisis didn't come to Timmins and do a market study to figure out where the best place the opioid crisis should be. So it's affecting all of us regardless of whether we do anything now or never. So I really appreciate seeing the progress we made. So I do have two questions. What's the staff complement for these SHST? Like what kind of positions or qualifications would I expect to see in there? And what's the relationship with living space? Is there any duplication of services is another concern of mine. Thank you.
Yes, so who'd like to tackle that one? Patrick, you've been volunteered.
So I can get into about the staffing complement as well as the hours about the site as well. Now the staffing complement, you'll have a registered nurse, a registered practical nurse, who would require their schooling and subsequent degrees and diplomas for that, as well as the training that we'd be offering in terms of, naloxone administration, training on stigma, for instance, CPI, and oxygen and things like that. But then there's two other positions. And so there's a harm reduction worker, which should be a social service worker or an alcohol and drug counselor, or I can't get the diploma off the top of my head, but something to that equivalent of a diploma at Northern College. The patient engagement and safety liaison is another factor as well, where the qualifications for that particular position may not necessarily be as high as, say, a social service worker, or addictions counselor, or a nurse. Ideally, I would like to have someone with lived experience. And ideally, I'd like to have someone who's been there, who can best build the rapport for people. We do intend to, support that person on a, there are several part-time positions. It could be anyone with past experience, say at a place like Living Space, or a place where they've worked with someone who uses substances. So those would be the four positions. And lastly, about the hours, is that this isn't a 24/7 operation. This would be a 12-hour thing that would be around 9 a.m. to 9 p.m. And this was based on the 911 call data that we've had with CDEMS. So this wouldn't be something that people would use like in the middle of the night and then go, which is in itself could be a safety issue, not just for but also for that person. So that would be the approximate hours as well. In terms of the duplication in regards to Living Space, I don't feel there'd be a lot of duplication unless I know they hand out nasal spray, naloxone, and harm reduction supplies as well. But in terms of the duplication, in terms of the service delivery, I don't see much of an overlap, unless, as they are also a huge referral source for agencies downtown as well. So we do intend to keep close communications with all relevant partners who might use that particular site and have that same clientele. But in terms of service delivery, I'm not seeing too much of a duplication there. It's a
Very good. Thanks, Patrick. Inspector Dinel, you have a follow-up with that comment?
Yeah, sorry, I'm a little bit behind. I'm back on kind of Joe's question, and just to comment on it briefly, just about the metrics that we're looking at to see if this actually works. Kate had mentioned that this is a multi-pronged approach to it, and an overall drug strategy that's going on, but we're very closely monitoring the EMS calls for service. We're also monitoring the fatal drug overdoses that we have in our community. And we know that those are both very high, and they have significant impacts on both the community and our emergency services. So those are something that we're monitoring on a regular basis to see where they're going. And again, this is expected to bring those down, and we should see definitely a decrease in those areas. Again, this is for saving lives, so we're expecting less fatal drug overdoses. And again, the Guelph model that Tina showed some of those numbers. There's 188 overdoses that they intervened in. That's potentially 188 overdoses in our community that we don't have to send an ambulance to, or police as support services to those. So those are some of the numbers that we look at on a very regular basis as we have our emergency opioid task force that gets together to take a look at it. And then just in response to kind of the good neighbor part of it over at Cedar Street, we've learned a number of the issues that took place back before, and we've tried to do what we can to mitigate those things. So we did learn from it, and that was a key aspect of having the police involved with providing some input with the policies, procedures, and kind of the setup, how they were going to have it over there with the risks to mitigate some of those things. I can say that as far as the police in the city, we did have a CCTV camera expansion that saw a number of high-end cameras, better technology in that area, that we had the expansion that we got it up and running back in the fall. So that was one of those aspects that was kind of ongoing prior to the site coming up, but that is something that's enhanced that safety aspect over in that specific quadrant of the city. So hopefully that answers some of those questions or concerns.
Yes, thank you, Darren. And actually addresses Mel's earlier question about safeguards, and I think Patrick touched on that as well. Just as a heads up to our panel, our media partners wouldn't mind a minute or two after we conclude just to ask direct questions so that they can have them in the news tomorrow. Any other questions from the floor? This has been a fantastic oversight. One of the things we have talked about at the various chamber meetings and events in this last several months has been so-called face of leadership. And in my opinion, when Doctors Belmer and Sampson kicked off their deposition to council, we really did start to see the face of leadership. And this is following on this very program is following on the heels of that theme, and that the face of leadership in our community, you'll never know where it comes from, but these are so important, and it includes so many overlapping agencies and elements of our society. So congratulations for this. Is as we know, quite often information is the ticket to community acceptance. We, initially, even with when it started with living space, some of the negative, if you dip your toe in the comment section on Facebook, which I don't recommend you do, the ignorance that's being spewed, and it's information from the professionals that allow the community to understand and accept this. I saw a post by Councillor Robin that the sky indeed is not falling. We're talking about this stuff, and it's important to share. So I do really want to thank all the panelists who've joined us today, and Meagan and Lianne and Tina, Pat and Darren. This is fantastic discussion. And special thanks to Kate Fife and her team at Timmins District for joining us as our event partner. We value our partnership as we seek to grow our community and ensure that Timmins remains a great place to live, work, and play. If anyone on the line is interested in supporting one of our events, please let us know. And today is just one in a series of chamber events that we're hosting to ensure that you, the business owner, have the information you need to understand how Timmins is initiative new supports for those suffering from mental health and addictions. And if you have suggestions for our next topic, please reach out. Be sure to register for our upcoming International Women's Day event with Karina Moore. She's the CEO of Ontario Northland. This will be held in person on Wednesday this week at the Donny Club. And to register, just check out our website. And again, we'll ask our panelists just to stay on the line before we close off this meeting. And we have a couple of questions from our media partners. Once again, thank you so much, folks, for joining us. It's an excellent event, and I really do appreciate your time. Thank you.
Thank you, Rob. And at this time, I'll call Andrew Audio, Timmins Daily Press. You have the floor.
Yes, hello. I just have a couple of quick questions here. I'm sure the Timmins police presence has been mentioned. I know it was earlier, but just a fairly obvious one here. Is there going to be kind of an increased patrols in the area to, let's say there's, maybe this area could attract dealers and such. Is that going to be, I know you said there's going to be patrols around the facility, but I'm just wondering if someone could touch on that, like just nefarious characters maybe being attracted to this area.
I'll just speak up, Andrew. So there's not going to be any increase in police presence there. We have a very close connection with the hospital, specifically with Nat and Pat. They're monitoring that on a regular basis, and if there is any issue, then they'll contact us and we'll deal with those issues specifically. But the site is going to be there to operate on its own. They have their own security mechanisms and measures in place. They have their complaints mechanism in place, so they'll receive it as they need to. And again, we're meeting these individuals have made themselves completely available to me and the police service if we need to get in contact with them, whether it's myself or a frontline officer that needs to get a hold of them to deal with something immediately to address those things. That being said, they do have some specific security measures and policies in place to address them. And we do have a CCTV camera expansion program that got rolled out in the fall. So if we do need to go look at anything, we do have those things in place that we can go back and deal with them after the fact.
Okay, great, thanks. And just the second one, I guess, would maybe be for Patrick. Why would a user go to this facility? I know obviously you talked about how it's very central and all of that, but let's say someone from the far west end or far east end. Yeah, why is there what are the strategies, I guess, to encourage people to use this facility?
There's a variety of reasons why someone should be using at Safe Site Timmins. I mean, first of all, the Porcupine Health Unit, TDH, and the rest of the Opioid Emergency Response Task Force has been diligent throughout the years in reinforcing a lot of those harm reduction measures, like not using alone, always carrying naloxone, and so on and so forth. So, they are people who do use are generally aware of the risks of using substances. If people are out in the far west end or far the east end, that's why we picked a location that is sort of central in terms of transit, if people want to use that, or it's also within walking distance. As you know, the location of the site was chosen because of the number of incidences throughout the area. But if people do want a reason to go, they're able to be observed while using. But secondly, if people are looking for a place for help and they don't know where to go, SHST might be that door for them to enter. So if they're not aware of anything else, they'll at least be aware of our supervised consumption site and access that in order for enter that road to recovery.
Perfect. Thank you so much. Excellent presentation, everyone. Thank you.
Sorry, Andrew, just before you get off, I just wanted to make sure to add one quick thing that although we're not doing any extra patrols or anything like that, there is still a zero tolerance policy for any trafficking activity that takes place. Those are conversations that, of course, we've had with the operator and our other community partners. But as far as trafficking activity, there's zero tolerance, and we'll deploy our resources as necessary to deal with any of those issues that arise.
Great. Thank you.
Follow up, Andrew?
No, I'm all set. Thank you very much.
Thank you. One final question. Maya Hogg at Timmins today. You have the floor.
Hi, I just have a question about the location. There's just always been the conversation that this would be, as we apply for the temporary site, we'd be having the conversation and the work behind the scenes simultaneously for the permanent site. Having looked at 6 locations, can we assume that this will be the site for the permanent location as well, or are we still having our options open for that?
I think throughout the application process, I'm not going to speak for the whole Timmins and area drug strategy, but I think throughout the application process, we do need to keep an open mind based on what happens at SHST, and it depends on the consultations with the community, with the stakeholder, as well as the people who use substances. And if they find that it's not a location that they like or like going to, then of course we would have to have that conversation of where else could it go. So we'd like to keep an open mind, at least from our end.
Follow up, Ryan?
Just is there a time frame for when you would have to make that decision?
I can speak to that. So as Pat mentioned, the temporary or the UPHNS or Safe Health Site Timmins, the exemption typically is for a certain amount of time. It is a temporary site. We are, as a community, very hopeful to not have a disruption of service. So our goal is by the end of a year, and I'm putting this because there's always exceptions that it could go a little bit longer, a little bit shorter, but that we would have a longer term site up in place. But I agree wholeheartedly with Pat that we don't know where the final site for CTS. One of the major differences between I'm calling it a CTS, sorry, a consumption treatment services site, which is the longer term site that comes with funding from the province of Ontario. For that application process to the federal and the provincial government, you do need to have a have engaged your community. So we're in the process of that, and we will have to look at what we are hearing from people to take into consideration about site selection for a longer term site. So it really is open to where the longer term site may be, but our goal is definitely to have it up and running so there is no disruption in services, which would give us a target of about a year to do that.
Any follow-up, Maya?
No, that's perfect. Thank you.
I hand it back to you, Rob, to close this out. Thanks.
Let's put a ribbon on it. Thank you, folks. Excellent discussion. And thanks for supporting the chamber and allowing us to bring people together to talk about these key events in our city. So have a great afternoon. And thank you so much, folks.
Thank you. Take care.